Autism is a word we hear often, yet for many, it remains a mystery. What does it really mean? How does it affect children and their families? And most importantly, how can we create a more understanding and supportive environment? Welcome to another episode of Live Out Your Potential, the podcast series brought to you by Solid Minds Counseling Clinic. I'm your host, Claver, and today we continue our conversation on child developmental challenges, this time by focusing on autism, what it is, how it is detected, and the kind of support that make a difference. To help us navigate this topic, I'm once again joined by Kate Wolf, a seasoned behavior therapist with over 25 years of experience working with children and adults facing behavior challenges. She's a consultant for Solid Mind. Kate, welcome back.
Hello.
We're excited to continue this conversation with you. And once again, I would like to start by giving you some time to briefly talk about who you are and your experience.
Okay. I'm delighted to be here in Rwanda supporting Solid Minds Counseling Clinic. I've worked in the field for 26 years, starting in 1999. I have extensive experience of working with children of all ages and their families across the UK. I set up programs that are with the aim of increasing skills and learning and decreasing unwanted behaviours.
Mm-hmm. Right, so I said you're a behavior therapist, but what would that mean in simple terms?
In simple terms, what it means is that I would carry out an assessment of where the child is at across all different skill areas, and then I would put in a program to work on those gaps in their learning and their understanding, their play skills, their social skills, and also their academic skills. Mm-hmm. And we would work on those by analysing the environment to see what changes could be made and how manipulations could be made to increase learning. Mm-hmm. We use reinforcement, which is one of the principles under which I work, which is about providing consequences following behaviours that you want to see repeated. Mm-hmm. And with that, you can increase learning and decrease the things that you don't want to see.
Autism. So autism is a widely discussed condition, but many people don't fully understand what it is. Can you give us a simple definition of what autism is and also stress out why it is called a spectrum disorder?
Autism is a lifelong disorder, condition, and it's a spectrum disorder, meaning that it affects people in many different ways. Some of the main signs of autism could be in communication and interaction. You might see repetitive behaviours and sensitivities to light, sound, noise, touch, taste, frequent tantrums and meltdowns, difficulty understanding the perspective of others is also one of the main features of autism spectrum disorder.
Mm-hmm. Repetitive behaviors, what are you referring to?
It could be repetitive behaviors in terms of play, so wanting to repeat the same play actions with a particular toy, not wishing to change according to what somebody else would like to see, and also repetitive, what we call vocal stereotypy, which means repeating things that the person has heard either on a video or in the environment that they like to hear over and over again. We can call it scripting. So it might be lines from a film or a television program, which have no function or relation to what's happening in the environment.
So in our previous episode, we discussed about child developmental challenges in a more general way. And it is clear that autism is very different. And I'd like you to take us through the process of recognizing autism and other signs.
Yes, it's true. Autism is distinct from other developmental delays. Some developmental delays or conditions may co-occur with autism, such as ADHD, sensory processing disorder, are very commonly found with autism. But it is a distinct condition. There are early signs, there are very early signs, but there are also signs that can be picked up later on. From a very young age, you could notice that your child isn't following the normal developmental patterns.
When you say early age, what age are you talking about?
Well, currently I'm working with very small children, sort of 1 year old up to 18 months in age, where you notice an absence of eye contact, pointing. Typically developing children point at things in their environment. It's a pre-verbal communication skill. And it's very often absent in a child that has autism spectrum disorder. And that's something you notice from an early age. Parents report to me that when their infant is breastfeeding, they may not make eye contact with their mother. They may also find certain things uncomfortable, which is to do with the sensory system, sensitivity to sensation, touch. So, for example, during nappy changes, there might be crying, tantruming, that you find difficult to understand why it's happening. So there are very early indicators. Another one, which is, I think, very important, is a child failing to look up when somebody enters the room. So the parent or a person might come into the room and the child would not look up to see who it is and would not respond if their name is called. That's a very common one. There seems to be an emphasis with children and adults with autism on focusing on objects instead of on people. And there's a lot that can be done very early on to address this, which I'll talk about later. As the child gets older, there will be more noticeable, less subtle signs.
Like
isolated play, so preferring to play with toys on their own and carrying out repetitive movements with those toys. Also, as I talked about before, a focus on objects. It could be that the child turns over a car and focuses on the wheels and the movement the wheels make, which could be unusual behaviour. So a fascination with objects over people is something that is noticeable. Problem behaviour, delayed speech at 2 years is an indicator as well. You might find that your child uses speech, but in a non-functional way, so they won't be able to point and ask for milk. They might use another word, or something that they've heard, a phrase that they've heard on YouTube or similar, rather than using language in a functional way to have their needs met, to ask for what they want. That's a very early indicator. So the child might be highly verbal, but not use language in a meaningful way. And again, that's something that we can really intervene on to change so that language becomes functional. And at the same time as decreased language, you see the effect that has on the child's behaviour in terms of frustration in not being able to have their needs met because of their reduced communication.
Thank you. Now, I want you to help us understand. I once visited a school that takes care of autistic children, and there are things that are easily observable, things to do with their behavior. There are those who are very aggressive. There are those who cannot stand much noise. I actually remember that some kids had headphones put on, and when I asked, one instructor came to me and said, we do this to make sure we can support them to reduce noise, because once the noise is too much in their ears, then it's so hard for them to cope. There are also those who were very calm, isolated, who did not want to play. And I want you to help us understand these variations. What do they mean, and why do they vary while we are, talking about autism, which is what they all suffer?
Yes, it's a wide spectrum. So there will be children within that spectrum that that are more able than others. I would say that aggression is almost always as a result of not being able to communicate their needs. And you see the child learning that if they become aggressive, or if they perhaps bang their head, or if they push somebody or pinch somebody, that there's a lot of attention around that. So they see the impact that has on the environment and its value for them as a non-verbal communicator, perhaps. So it increases, and they do it more. So you can always analyse the reason as a behaviour analyst as to why aggressive behaviour happens. And I would say, in my experience, it's most always to do with reduced ability to communicate. It could be also a way of communicating pain, discomfort. So you mentioned about sensitivity to the environmental factors, sound, noise, sound and light. And again, that child may withdraw because they find it difficult to cope with all of those things that are going on that are overwhelming them in the environment. So they may isolate themselves. You talked about wearing headphones. Yes, that it does help reduce noise in the background. I think seeing an occupational therapist, they can provide those headphones. In my experience, it can be more helpful for the child to be exposed to sound so that it desensitizes them to it. Because if you have headphones on for long periods of time, you become isolated.
So now these were kids of, I would say, 7 and above, between 7 and 16. But I want to take you back to those who are little and ask you, what should parents look out for in terms of detecting signs of abnormalities?
So the pointing to objects to show, so what we call joint attention. A child will point to an object and look back at their caregiver.
What does that mean?
That if they're failing to do that, that is a strong indicator that there is a possibility of a developmental disorder. Typically developing children point very frequently as a means of non-verbal communication. They gesture, Facial expressions, inability to perceive, to recognise and pay attention to facial expressions is also an indicator. Not looking up when somebody comes into the room, a familiar person comes into the room, the child doesn't stop what they're doing. And again, if their name is called, they may fail to look up and respond to their name. In young children, play, repetitive play, also finding it difficult if routines are changed can also bring about challenges in behaviour, because things are no longer predictable. And if a child is finding the environment a confusing place because they don't understand language, or there are noises that they find uncomfortable, then they would find that difficult.
Quite complex.
Yes.
And this reminds me of friends who had a typical developing child, but when the child turned 3, some unusual things started happening. She started losing her speech ability, and that's when they noticed that there was an issue. And that child was later diagnosed with autism. And I want you to kind of touch base on that and explain what really happens to
Yes.
see, a child who was born in a normal way, developing from few months to 1 year, later 2 years, and then 3 years. And these signs of autism started really showing up when she was 3. What happens in between that contributes to...
Yes, I mean, parents very often report this. They report that their child has lost language and regressed at the age 2-3 years old. It's very common. What I haven't mentioned actually is about physical development, because physical development generally is children reach the milestones in their physical development at the same time as typically developing children. So in the cases of parents reporting that their child has lost their skills, what I would say is that those signs, early signs, probably were there, but as diagnosis is improving all the time and signs have in the past gone unrecognised, which may indicate autism from an early age, it may be that the child actually, in fact, was missing some of those developmental milestones, but they weren't perceptible by the parent.
This also brings me to another question. We have situations where in a family of 3, 4, 5 children, you find that only one is autistic. How do you explain that?
Well, as we know, autism is strongly genetic, and what I would say is that you may find children within a family where siblings are affected to a greater or lesser degree. So there may be a child in the family who is severely affected with autism. They may have no language, poor imitation skills, which is another factor that I haven't actually touched upon, but is also included in sort of early signs of autism. And it might be that those other children in the family do have traits of autism, but they're more subtle. And that's what I've seen in my experience of working with many, many families. If one child has severe autism, I would say that the siblings have traits of autism.
So what you're saying is that for families who have autistic children, you are sending a red flag to parents to say maybe one is severely affected, but also attend others and find out.
That's right, and it may just be signalled by when they start school, they start to have problems with friendships and social skills are impaired, and they may not make friends very easily, or they may struggle with learning and understanding when they reach school age, which weren't noticeable until they began school and started being with peers.
So again, let's look at the support that is available. And my question here is about what types of therapies that can help children with autism.
Well, behavioural therapy is highly effective. There's a lot of research behind, evidence-based behind behavioural therapy for children and adults with autism, and increasing skills and learning so that the child reaches their potential and can live fulfilling lives as part of the community. Behavioural therapy, along with occupational therapy to help with the sensory challenges, but also some of the fine motor challenges, which I haven't really mentioned much about, but that is another sign. Is if a child finds it difficult to manipulate objects, that could be, along with other signs, an indicator. So an occupational therapy would help with learning to hold a pen, with some pre-writing skills, movement, gross motor movement, jumping, and other sporting activities to improve their strength, their muscle tone, which can often be weak, and speech and language therapists who work on understanding and improving understanding, and so that the child learns to follow instructions better.
So, occupation therapists, speech and language therapist, and then behavior therapist.
Yes, in collaboration.
In collaboration.
Yes.
I kind of hold this question, but I feel like this has to come out. You talked about genetics, again, to do with autism, but there are also conspiracy theories around vaccines that are administered to children or to their parents. Is there any link between autism and vaccines?
There can't be, I think, because it's the strongly genetic component of autism. It is highly unlikely. I would say it's more to do with the interaction of genes between both parents that autism is the source of, rather than vaccine. It's highly unlikely. I would say yes. The risks are minimal.
So, those of you watching us, autism and vaccine, no link at all. Don't shy away from taking your kids to, get the vaccines they need to take. Rather, if you see them struggling, or if you are struggling as a parent to support your child, seek support. And this brings me to another question about living with autism, right? And the question is, can autism be cured?
Autism is a lifelong condition. It can't be cured, but we can do so much to improve outcomes for individuals with autism, especially if you start intervening from a young age. There is evidence, recent research has shown that if you intervene with a very small infant, the brain can be rewired, as it's plastic at that age, to change some of the autism symptoms.
So now let's zoom into, I would say, ordinary life, and be practical and ask you about how can parents and families best support children with autism.
So from a very young age, if you notice any signs and your child is under-responsive, what I would do is I would advise parents to talk to their children as much as they possibly can, reduce their isolation at home by attempting to engage them in play activities, showing them how to play with toys, because many children with autism, they don't understand how to play with a toy in the way that it's designed. So I would spend time sitting, doing puzzles, using shape sorters, and while doing that, I would use exaggerated facial expressions and language, short phrases, but with a lot of expression, because as I mentioned before, kids with autism don't always attend to people in the same way as they do with objects, so you want to emphasize facial expressions and tones of voice to try and draw your child's attention to the importance of you and what you can bring in terms of play and fun. Have fun with your child at home. If the child is seeking activity, movement, I think having one of those gym balls in the house to bounce them on, a mini trampoline, they're fantastic activities to do with a child that enjoys movement, and many young kids with autism really seek movement, and they can have fun. Eye contact is easier to achieve if you're playing a physical game with a child. Spend time to teach them new things, teach them self-help skills, show them how to look after themselves, to get themselves a drink, to use a cup, to use the toilet, practical skills. They can learn these skills. They won't learn them. They may not learn them automatically, but they can learn them if you spend the time to focus and work on them and give lots and lots of praise for achievements, little achievements, because that will increase learning.
So now let's look at the role of the community in this long journey of supporting autistic children. What do you believe should be the role of the community, of schools, where some of these kids are taken? Personally, I know 2 schools so far in Rwanda who only take care of autistic children. But I also know that there are some other autistic kids who are taken to normal schools where they get to play with other children. Maybe you can also talk
Yes.
about that. Is it a good thing to put them in, I would say, normal environment where they get to play with other normally developing kids? And if yes, what are the tips for those kids and their teachers to support the autistic children?
I'm a strong advocate for inclusion, because I think children with autism need to see behaviour modelled by typically developing peers, to see how they play, to see how they communicate, to see how they follow instructions, and to mimic that behaviour. So I would say that inclusion, when it's possible, has a very good outcome. There may be cases where a child is severely affected, where they find it very difficult to access classroom activities. But on the whole, inclusion is a good environment for a child so that they can be part of the community, not be excluded. And what you might see if they were in autism-specific schools is that they might copy each other's maladaptive behaviours. so not have the model of typically developing children to learn from. And, in terms of supporting parents, I think setting up support groups where parents can actually talk to each other in a safe environment where it's confidential, they're not going to feel judged, and they can exchange views and experiences, talk to each other, and share information about resources and professionals that they have worked with who've supported their children. Awareness in schools about special educational needs, what you can do to increase learning in that environment, such as movement breaks and visuals to help learning, and just an understanding of the differences that an individual with autism has to contend with on a daily basis in terms of noise and sensitivities and reduced understanding, difficulty communicating. It's with more understanding in schools and communities of those differences. I think it would mean that people would progress.
Thank you so
the
much.
Outcome.
Yeah, thank you so much indeed for sharing your knowledge and experience. Is there anything that you'd like maybe to add before we wrap up?
I have a lot to say, but I think for today we've covered the main points. But if anybody wants to ask specific questions, they can come to Solid Minds and find out more information that way.
Wonderful. So in today's episode, I noted a few key takeaways from our conversation, and thanks again for sharing your wisdom on this. As you put, autism is a spectrum disorder, which means that it affects children differently. You talked about different signs, different behavior these autistic children show, from being sensitive to sound, light, to developing some aggressive behavior because they are not able to communicate the way they want to communicate. You also talked about early signs, which include eye contact, delayed speech, and repetitive behaviors. You also mentioned that behavior is not a disease, therefore it cannot be cured, but the earlier we seek support, the better for improved outcomes in autistic children. So parents watching us today, whenever your instincts tell you something about your child, seek support. Come to professionals. You talked about behavior therapists, you talked about speech and language therapists, and also occupational therapists who come in to help these children cope with how they manage their life. I also noted the importance of this whole process taking so long, to give us the kind of concrete results, if I may say so. So diagnosis can take time, as you put. So parents should seek help as soon as they notice concerns. And lastly, we were talking about the inclusion. Support systems exist. You can come to Solid Mind to seek support, but it is also very important to say that everybody has a role to play in terms of understanding that these are children like others, and they need support, they need understanding. And when adults struggle to find what to do, they also need to come and seek support to professionals. So as we depart, Kate, I want to give you a few seconds to maybe offer your last words.
Well, the message is, if you notice early signs, seek help straight away. Trust your instincts. They may tend to be without foundation, but I think it's wise to seek help as soon as you have concerns, because there's so much that you can do to improve the outcome of children's lives and so that they reach their potential and live happy, fulfilling lives in the community.
Thank you so much. It is indeed wise to seek help. This was Live Out Your Potential. The topic of today was autism. I hope you are able to share these episodes in your networks, and we invite you to subscribe to our YouTube channel for more updates in coming days. Until next time, I'm Claver Irakoze, your host on Live Out Your Potential podcast series. Thank you.